Hello, families. Hey, I want to reach out today. It's Sunday. It's March 22nd. Kim and I are back. I've shaved. I took myself out of what looked like the prison cell I was in. And I just wanted to kind of communicate kind of sum up again, just kind of give you an update on what we're doing and where we're at. So I first just want to say thank you for all of your support. We've just had tremendous support for the center, for our staff, for our teachers, just for working so hard to be there for your kids. And that's just so reciprocal from us. I mean, we're just so great and thankful that we have such great families that we're working with and so appreciative. So thank you, because I know we're all working hard and getting things taken care of that we need to take care of. So thank you also for just that communication on what your plans are. Everybody's has such a different circumstance with everything that's going on with COVID-19 and so forth. So I just appreciate all the communication on whether your kids are going to be here, whether they're going to be out. We're completely retooling our staffing right now based on the numbers of kids we had last week, which we were, just under half capacity. So I want to talk about some of the things that we're going to be doing in the center. I also want to thank all of our parents for calling and saying, hey, I've got a cough today, so I'm just going to keep Johnny home. Or, he's just got a little bit of, he's just kind of off. So I appreciate that. Thank you. I think that the way to move forward is being very proactive and very responsible. And so thank you for all of our parents for doing that. And we'll continue to do our best to communicate with you as to any relevant updates that are going on in the center and so forth. I want to touch base with you real quick on an update I received here just this, I think it was Friday, from the Office of Early Childhood, and kind of give you their guidance for childcare centers like ourselves, like Discover here in Colorado. So here we go. On March 18th, the governor issued an executive order that required all schools in Colorado to suspend normal in-person instruction, through April 17th. So as we know, our district has gone from April 10th to the April 17th based on that executive order. So anybody that communicated that you'd be out to the 10th, we've extended that to the 17th. We don't need communication on that. And this includes public preschools on public school campuses. The executive order also directed local health agencies to work with child care providers in preschools not operated by P through 12 schools to determine if it's safe to continue operations. So that's where we fall under. Order states that there's a confirmed case of COVID-19 in a child, caretaker of a child, or a staff member, the facility will close for 72 hours. That's still the direction we will follow. During the closure, major cleaning, which we're doing every night. We have ramped up our disinfecting through our fogging machine every night, 5 days a week, in addition to the regular sanitation and disinfecting. They continue to provide guidance that child care programs that have not had a confirmed case of COVID in 19 in a child, caretaker, and so forth, or staff member may remain open, but should continue to follow guidelines of health and safety and all of that. They released, so addressing the public limit of mass gatherings to 10 or more people. The CDPHE guidance does not require child care providers to limit the number of children in their facility to 10 or less. However, social distancing should be implemented whenever practical. Keep children in small groups, increase outdoor playtime, and continue to follow all cleaning and safety guidelines. So that's what we're going to do. And so one thing you'll notice is that we're going to, whereas in a normal environment, if we had maybe 20 kiddos, we'd have 2 staff with 20 kids, which is the ratios and all of that for our classrooms. However, we're going to keep kids in their own classrooms. So if we have 5 toddlers in Fruita, we're going to keep just 5 toddlers in their todd room with 1 teacher. Early preschool, we had 10 last week on average. We'll have 1 staff. They won't be combined with preschool. Preschool has 10, they'll have 1. pre-K school age has 12, they'll have one. Instead of 2 with 24, we'll have one with 10, one with 14. So we're going to work to really make sure we keep those groups separate. Same in Fergus, same in Grand Junction. We're going to maximize outside play. And so just to help follow that guidance, we'll be implementing those things. You'll see that. And this will be within reason, as it says. So when you show up in the morning, we may have probably one staff there and the 3 kids will be together. But as our next classroom teachers come in, they'll be pulling their kids appropriately and will not be combining until we're at that 10 or less at the end of the day. So we'll be really watching that. What is our position on all of this? And I understand there's all kinds of positions. I've had parents have emailed and said, hey, we're at risk. We want to keep our kiddos out. Or, hey, we're just going to stay out until school comes back. Or, hey, I need to work, and so my kiddos are going to be there. So we consider all of those things. And, our position is to follow the recommendations of our local Office of Early Childhood, our county, as well as listen to our families. We know we have a lot of frontline workers, and we consider ourselves as a child care providers frontline support. We have doctors, we have nurses that without child care may not be able to go to work to take care of our sick community members. And so that is our commitment, to make sure we're there for you. We have parents, single parents that work at City Market. And without an opportunity to bring their kids to us, you're not going to go get milk and TP. Well, you're not going to get TP anyway. I'll talk about that here in a second. But so we do want to continue to support those families in the responsible manner that we can. So that is our position. We realize at some point, if there is a confirmed case of COVID-19 in the center or by staff member, automatically we're going to follow those guidelines 72 hours and then follow further guidelines. And so there could be a case between now and summer, let's say, that we maybe are closed, whether it's for 3 days or 3 weeks or longer. And so we're continuing to make some contingency plans for that. But we want to continue to support our community, support our families, and meet those needs. One of the things in this message here said, it talked about the recommendation of essential workers and emergency workers, and that without this kind of care, they may not be able to return to their jobs. If you are not one of those, I've had parents say, well, what do you recommend? Do you recommend that we keep our kiddo home if we don't have to bring them? I think that is a responsible stance. I think there's a lot of reasons why, why it would be responsible to have your kids come as well. So I'm not going to give a firm order on there because I don't want to be judgmental on what your decision is. But again, we want to stay open specifically, especially for our families that are needing. They're either frontline workers, emergency workers, but the reality is we're all workers, and without that paycheck, we're going to be, looking for that next meal for our kids. So we're there for everybody. So you don't have to be a hospital worker or a nurse or a firefighter, bring your kid to us, because it's all critical care. Okay. So what is our plan moving forward? We're going to be modifying our staff schedule. We're going to be looking. I'm going to be looking over the next probably 3 days, Monday, Tuesday, Wednesday. I need a little bit of time to just put in place a bit of a financial plan and budget to see what we need to do to ensure that we are here with full staff, hopefully fully open, ready for everybody to return to normal. Whether that's April 17th when school is scheduled to go back right now, whether it's June 1st, the beginning of the summer, whatever it is, I want to make sure that we're positioning ourselves in such a way that we'll be able to be here for your families when you go full back to work. But I also am working on trying to come up with many scenarios on tuition. I think everybody's clear on what our tuition policy is, but that was not based on the current status right now. So I want to work on figuring out ways to mitigate and minimize the financial impact and hardship that paying for childcare would put on a family when you're not utilizing childcare in order to go to work to get that paycheck. So if you can bear with me for just a few more days, I should have something by the end of the week on what that might look like. But for the most part, at the moment, tuition policy in place as usual, probably through the end of the week, as well as the end of the month. But I really want to try to figure out what I can do in April and May to really help families. There's some that say, I'll just come back in summer, I'll come back when it's all cooled down, or I'll come back as soon as I can, or I can be out for 3 weeks, but can I drop in when I need to? So all of those kind of factors, I want to create some fair policies, and a lot of it will be case by case. We have families on different hardships and so forth. So I've had some good ideas that have circulated, some from families, so appreciate that. But I'll give you more of that when I have something more concrete. I'd rather tell you what I can do than what I hope to do. I don't want to hang your expectations on my hopes. So just hang in there with me for a little bit more on that. I've reached out to my staff as well, because as our numbers drop, our staffing needs to drop, because obviously we can't meet those monumental payroll expenses with a third of the kids in our care paying tuition. So I've asked them if they're interested in providing some home care for some families. So if that's something you're interested in, feel free to send an email to us. Say, hey, I would be interested in having Josie or Lisa or Deborah, made up some names, that maybe could come to my home, and maybe me and the Jacksons and Jeffersons could get our 6 kids together and have one of your staff come to my home and we could pay them. I would be really interested in working with that. I just have to answer a few more questions like, how do we work that? Do I get involved? Do I stay out of that? There's liability. I don't know. So I got to work with that. But if those opportunities exist out there and they would help you get to work, or you have good care for your kids, if we were closed, or if that was your preference and it allowed my staff to get paid in this interim period, then I'm in. So I want to help my staff be there when we're at full capacity again, which hopefully will be very soon. So email that. Feel free to continue that email notification, communication. I appreciate all of that you've given us. And as I comb back through all the emails and over the next week or so, start making hopefully some account adjustments and plans on whether there's some additional credits we can give and those kind of things. We have ideas. Just give me a little bit to put those in place, and I'll continue to communicate that with you. I want to finish with one last thing. And Kim and I were sitting down talking about some partnerships, things that we could do in the interim. And so there's a lot of different things that our center could use if we were to close for a temporary time, and that may be able to partner with some of our families to mitigate some of those expenses and so forth. So things like painting, things like woodworking, carpentry, HVAC service. If you have some skills that you would be interested in partnering with, maybe you're down to a one-income household right now, and so one of you is available maybe to come in and do some work and to help mitigate some costs by doing that. So we could trade out some childcare or future credit even. So if we can help you with a financial burden in that respect, send an email and just say, hey, here's my skill set, or here's my husband's. He's available on the weekends, which would be great. So, and we'll continue to build a list of things that we could do at the center to continue to optimize our program. So where everything's back to normal, we're up and running, we've got a brighter, better, cleaner, neater, greater facility for you and your kids. So again, thanks everybody. I'm so fortunate to be partnered with such a great community and all of our families. So thanks. We'll talk to you soon.